I'm Amanda Burry. I'm the Chief Commercial Officer at Informatica. Informatica is the market-leading AI symptom assessment for patients, members, health plans, to help really direct and guide their patients and members to the right level of care. We really focus on providing convenience, cost, and accessibility. And we do that through an AI approach. So imagine it's 10 o'clock at night, your ear's hurting you, and you don't know what to do. We help provide an assessment that you can take that is then redirected back to your provider or to your plan. And they're going to kind of configure what you should do. Should you go see a telemedicine provider? Do you need to do nothing and just self-care at home, or do you need to call 911? It's all about providing those patients the best level of care and the best direction of care possible.
It's amazing. So I guess, how have you seen that kind of tool taken up in the Australian space? It must be quite different to working in the US, where you guys are from. How have you seen the differences in the two markets?
Yeah, so I always say we have the luxury of working with over 100 customers in 35 countries. Yeah. So we're a European, Polish-based company.
Oh, cool.
We also have a US entity as well. And so among our customers, we see multiple different implementations of our technology. We provide a flexible API that allows people to manage and control workflows that they're looking to achieve for their patients. Yeah. One of the areas that we are focusing on here in Australia is with a customer, NIB, where they have actually installed our symptom checker inside their mobile app. And so they are providing an engagement and education tool for their members to be able to triage to the proper levels of care, giving them that experience, giving them that accessibility in the palm of their hand to be able to become knowledgeable about what's happening with them based on how they're feeling.
Yeah, well, I guess we hear our healthcare system is so pressured. Not everyone can get to the GP quick enough, and we don't want to be funneling our people into the ED unnecessarily. Have you seen that as a sort of a solution provider that you guys are providing?
Yeah, it's one of the areas where we're providing the most value. Is we know that there is a lack of providers. In the States, for instance, in 10 years, we're going to have a lack of physicians by about 50,000. We can't even really educate or train people in that period of time to catch up. So we have to leverage AI tools and technologies to be able to help bridge that gap.
Yeah.
And so one of the ways that we're doing that is, how do we provide that, those low acuity primary care cases where going to the GP might take 26 days to get an appointment, or 10 days, which is even still too much. How can we help provide you a quicker teleconsultation or some self-care at home? And in addition, we really want to keep people out of the ED and keep that open for people that truly need it. So we're really helping to navigate or direct those patients to those right care endpoints.
Yeah. And I guess AI has obviously been a huge theme for this conference, and it was a little bit there last year. Mm-hmm. Is AI new for Informatica? What's it been like transitioning into the AI space?
Yeah, so we've been in business for over 10 years, so AI is not new to us, but we really look at AI as we want to be responsible and we want to come across as trusted, which I think are the two most important factors to anybody getting into AI right now. We've gone through years of testing our technologies, getting third-party clinical validation, which I think is really critical. And we also provide environments where people can test and sandbox the different workflows that we have. And so AI in healthcare has also not been new. So it's been around for about 30 years, whether it be radiology or imaging. They've been using those AI workflows for stroke detection. I just think now it's become more consumer-facing, and so it's getting that recognition of, is my doctor using AI? Does this mean I'm going to get less time? And instead of turning it scary for the patient, I think it's an opportunity for us to educate and engage them and let them know when AI is being used and how it's going to help give them a better level of care.
Yeah. I love that. You see it as a real opportunity. I think that's one of the things I've been hearing as well. I think we're excited to use AI, but responsibly, as you've said. So I guess working in your space, what do you see as the challenges to kind of healthcare at the moment, digital health?
So I think some of the challenges, globally and also locally vary, but there are similar undertones. So although I'm US based and although our company is based in Europe and we have customers all over, we see a couple of similar challenges. Number one is the overcrowding of emergency departments.
Yeah.
So this idea that people can't access the care they need, so they go to a place that they know is open for them, which would be an emergency department. I think the other part is listen, there are so many channels and tools for patients to use, and we've really saturated them with a lot of different technologies, but we haven't educated them enough to know how to use them. So getting patients to the right place at the right time with the right level of care still holds true today across different global markets. So I think really providing that education pathway point to how do I achieve the care that I need to. And then in addition, just really looking at some of the challenges around telemedicine. In the U.S., we're starting to see it wane a little bit in terms of usage, whereas in other places like the U.K., there's overutilization. So I still think we need to look at telemedicine as not this whole separate delivery channel, but just another pathway that a consumer or a patient can choose as a care path. We need to look at an in-person visit and a telemedicine visit in the same light.
Yep.
We need to reimburse them at the same cost and treat them as an appointment equally. And I think until that's done, there's still going to be a lot of velocity in that telemedicine space.
Yeah, good points. I guess any key takeaways that you're going to take back with you to the US that you taken from Digital Health Festival Melbourne?
Yeah, so it's been great being here. I think some of the takeaways are, there is a lot of opportunity in Australia, especially as it relates to the longitudinal record of the patient, right? Connecting the patient record across different care pathways.
Yeah.
As well as a lot of digital front door activities. So I think digital front door is a big theme here. But until you can really kind of have that patient interoperable between different positions, it might be a little bit challenging, but also very exciting because it just means that there's a lot of growth and a lot of possibilities for patients to have a much better experience.
Yeah.